Hi, I'm Turner Bales. I'm a physical therapist here at Franciscan. Dry needling is coming off of acupuncture. It's not the same as acupuncture, but we're using the same needles and we're treating painful muscle areas or fascial tissue to decrease pain and improve mobility. Dry needling, if you think about a muscle like a wad of spaghetti, like if the knot is like a wad of spaghetti and you're inserting the needle in the knot, then that helps break that knot up and that tissue up and releases the pain and discomfort. You stick the needle in the knot, it actually is kind of micro tearing that tissue and bringing about blood flow, so that helps create healing for that tissue. Dry needling can be a little uncomfortable, but it's really not that painful and there's very low risk with it. So while you may have a little discomfort in the beginning, it's not much more than like getting a shot. When you're getting stuck, you can feel a little bit of like a zinger, like you got stung, or you might feel like a little more gross aching pain or traveling pain, kind of similar to what you might be feeling when you come in. When patients get that similar feeling, we often say that it's a good sign that we're hitting a good spot. So it's one of those weird instances where if you're feeling pain, it can be a good thing. Relief from dry needling pretty instantly. After maybe initial soreness for about 24 to 48 hours, you'll feel the difference very fast. In conjunction with exercise and other modalities, dry needling can be very instant. It depends on the issue going on. Your provider will talk to you about your treatment plan, but typically it can be one session, but it's more like 4 to 6 sessions. There's very low risk and not very many side effects. Some people may feel sore and a little bit of bruising, maybe some prickling sensations, but other than that, not very many side effects. And your therapist can talk to you about the risk too, but it's very low risk, hardly any. Typically use dry needling in conjunction with other things. So we'll do dry needling and then we'll do some exercise. We might do dry needling and then do some massage work. It's not typically used alone, but it's used in conjunction with other things. So after you've done your 4 to 6 sessions, we might do more exercises and things to get you back to function, because that's the ultimate goal. You can do dry needling in about anywhere on the body. Your therapist can talk to you about where it might be best to do it to start off, but anywhere there's tissue, bone, muscle, ligaments, you can do dry needling. You can do dry, expect some initial soreness after your treatment. Like I said, maybe around 48 hours, rarely 72 hours, but after that soreness, you want to drink a lot of water to help replenish your tissue. But then really you don't have to restrict your movement. You don't have to restrict anything. We ask people to stretch a little more. But otherwise, it's like your typical day after you've done it. If patients are a little questionable on whether to do dry needling, we typically say you might want to try it once and see how it goes. You rarely will feel worse than you're already feeling. And the first session we can go very light, like we can only do maybe 1 or 2 needles and see how you feel. And then if you like it the next time, then we can try it again. But if they're skeptical, we can also say we can just wait until, if you're not getting the results that you want with other things, then that might be a last resort to try. So you do not need a referral for dry needling. A physical therapist or an occupational therapist can perform it. All you have to do is call a Franciscan physical therapy rehab number, and we'll get you set up with someone who performs it at one of our many locations.